Experts from the Africa Centers for Disease Control and Prevention and the World Health Organizations for Africa are briefing the media on COVID-19 on the continent. Let's cross live to that virtual briefing.
Collapse. And then the second question, we see rising numbers in South Africa. What's your observation? And finally, your message to the nurses out there today on International Nurses Day.
So thank you, Sophie. My message to the continent, my departing message to the continent is that it has to embrace a new public health, that the continent has to embrace a new public health order to ensure its health security sovereignty. The continent must embrace a new public health order to secure its health security sovereignty. I repeat that because it's so fundamental to what I've observed in the last 5 years, and this pandemic has kind of reinforced that. When Africa CDC was launched, it was very evident, and we wrote a paper and published in Lancet Global Health where we called for a new public health order. That was in 2017. And I think everything we argued in that paper came, unfortunately, to happen. And what does that mean? There are 5 things that I would strongly leave the continent with to look at very carefully if they have to guarantee the health sovereignty of the continent. One is to invest in manufacturing of diagnostics, pharmaceutical, and vaccines. For over 40 years, Sophie, we have been, as a continent, has been conducting more than 100 million HIV tests, but none of that is produced in Africa. Okay, I repeat that. Over 40 years, every year the continent conducts about 100 million tests, no manufacturing in Africa. And that is also true for AIDS drugs. Okay, so I think we know that you cannot guarantee the health security of your people if you do not have diagnostics, vaccines, and therapeutics. The second thing we are proposing to the continent as I depart is that strengthen national institutions and continental institutions like the Africa CDC, the African Medicine Agency, and other national public health institutes like what you have in South Africa, the National Center for Communicable Diseases or Infectious Diseases in South Africa. I think those are the kind of things that will better prepare the continent. The continent must also expand its public health workforce and adhere to that program that was submitted by President Ramaphosa to establish a public health task team, a public health workforce task team. That is so critical. Without an effective public health workforce, you don't have a chance to fight infectious diseases. As a continent today, I think the continent of Africa has only about 1,900 epidemiologists. The statistics suggest that for every 200,000 people, you need 1 epidemiologist. So that if you divide that by 1.2 billion people, it means you need 6,000. But the continent only has 1 point. So there's a gap right there of 4,000 to be filled in there. That the continent would need to have a conversation in that space. Fourthly, is engagement with the private sector. The private sector has been incredibly valuable during this the fight against this pandemic. Partnership with people like Mr. Strive Masiwa that you all are aware of. I mean, it's thanks to his innovation that we are able to roll out AVAD, roll out AMSP. People like the president of the Afro-Exim Bank, Benedict Orama, people like Dr. Vera Songwe and others, I mean, that I would not be able to list here, were extremely valuable. So we have to be very deliberate to say that the health security of the continent cannot be guaranteed only by the public sector. We must reach out to the private sector. Lastly is what we call action-oriented partnership with our partners, the partners, the traditional partners that support the continent. So I think those are the kind of things that must be done to guarantee the health sovereignty, the health security sovereignty of the continent. Your last question about the numbers in South Africa, again, South Africa has a very strong surveillance network, so they pick things very early. So some of the numbers that you are seeing there is a reflection of how good the surveillance system in South Africa is. And again, I remain confident that South Africa has the experience and expertise now to bend the curve. So this wave will come up. We don't know how high the peak will be, but I have no doubt that the country will mobilize and bring it down.
Thank you very much, John. We have a comment from Judith Akolo, who is with the Kenya Broadcasting Corporation, after which she puts forward her question. So her comment is, I'm following on live stream and I'm wishing Dr. Nkenga Song the very best. That's from Judith. Then she goes into her question. She says, my question is, now that everyone seems to think that the continent is safe from COVID-19, what happens to all the efforts that were aimed at combating the disease, like the vaccination drives?
No, let me just be very clear, and I hope I've been very consistent with this message, that we are not out of the wood yet. The continent is not out of the wood. COVID is there. We cannot confuse where there's a low transmission season, which is a trough, which the continent has enjoyed for the past 2 months with very low transmission, but now you see that the cases are coming back up. So it's this seasonality that you continue to see until the only way that this will be brought under control is by scaling up vaccination. So I think that is just, and the best time to vaccinate is, the vaccinated population is now, when we are facing a low transmission season there. So again, Judy, you're absolutely right. It just makes it harder for the population to accept this medical intervention. When I believe it was the third wave or so, when people were dying a lot, I mean, the demand for vaccines was very, very high. I mean, countries were calling us and requesting for vaccines. But when you see a low transmission season like what the continent has enjoyed for the last 2 months, you begin to see a decrease in the way countries ask for vaccines. But it is my appeal that this is the time to do 3 things. 1, increase testing. 2nd, increase surveillance. And thirdly, increase vaccination.
All right, thanks, John. Sarah Jerving, I come back to you. Please go ahead with your question.
Thank you so much. What outcomes do you hope come out of the Global COVID Summit today? Thank you.
First of all, let me just start off by really acknowledging and congratulating the leadership of President Biden. This is the 2nd summit. And that's the kind of leadership that I refer to when, if you remember, one of the P's I mentioned was political. There is good politics. That is very important for us to combat this pandemic. Now, I'm hoping that there will be a consensus that we need to focus a lot on increased vaccination. I'm hoping that so that there's a collective and coordinated approach to vaccinating, including in Africa, under the leadership of the AU and Africa CDC. I'm hoping that the test and treat will be highlighted, that, as I said earlier, they need to test more, conduct surveillance, and people that are identified are put under treatment quickly. I'm also hoping that there will be a commitment that that vaccine manufacturing is an important, regional manufacturing is an important tool for our collective health security. And also, of course, that manufacturing of personal protective equipment is key, and access to them as well. So those are some of the things that I'm hoping that the summit will achieve.
All right, thank you, John. We are almost coming to the end of our 1 hour. So perhaps let me give you this opportunity one last time for you to give us the main highlights of the briefing today.
Well, my highlight today is just a thank you message to all of you. I mean, I'm just to repeat myself, starting by those in the studio here, including you, Wayne. It's been remarkable journey for the last, I can't believe we are close to 2.5 years, but we are. This is May. So, and we've been doing this since January. So I think that has been a remarkable journey. My caution to the continent is that the pandemic is not over. It's far from over. We still don't know what variants will emerge. That vaccination to a scale to above 70% is key. But again, just to keep it short, is really to thank you all for the support, the encouragement, the partnership that we've all enjoyed from you all as an interface with the population. As when you rightly said, when none of us were moving around, only through your messages could we reach the population there. So I will be eternally indebted to this strong partnership and collaboration. And I hope that whoever is selected by the leadership of the African Union, you continue to support him or her in the same way that I was supported. Thank you.
All right, thank you very much. The last words from Dr. John Nkengasong, sitting in the studios here at the African Union Commission, as he will now be proceeding to take up his new responsibilities with PEPFAR. So I think that I speak for everyone, that is including those who are in the studio, from the African Union, from the Africa CDC, and all those who are joining us online. And I see a strong contingent from the Africa CDC that has joined us, including the Deputy Director, Dr. Ahmed Ogwell, and Dr. Benjamin Judalbaye, and a lot of the other Africa CDC staff members who have tuned in for this final press briefing of Dr. John Nkengasong. Let me thank you again, colleagues, as usual, for your interest in continuing to cover the issues of COVID-19, and I assure you that we will continue to bring you more information from next week going forwards. But for now, it is as they say, we meet to part. To Dr. John, we meet to part, and hopefully it is parting to meet again at some other point. We wish you the very best of God's blessings for you and your family as you start your new job. So colleagues, join us again next week on Thursday at the same time for our briefings. Bye-bye for now.